How's everyone doing? It's Isaac Wade, and in this video I wanted to talk about some scientifically proven methods I use to improve my physical appearance. Obviously, a lot of the products that I use are prescription products. They do have the potential to cause a lot of side effects, so definitely talk to your healthcare provider before using them. Now, I've divided this video into 4 different categories. We're going to be talking a little bit about hair, a bit about skin, about teeth, and some miscellaneous products as well. So let's get right into it. First of all, let's talk about hair. You might not be able to tell, but I've been balding since I was 19. However, I've been able to maintain my current hairline and density by using a drug called finasteride. Now, what finasteride does is it prevents the conversion of testosterone to dihydrotestosterone. And in most men, dihydrotestosterone is going to be the cause of male pattern hair loss. By lowering the amount of dihydrotestosterone that's attacking my hair follicles, I've effectively been able to freeze the process of male pattern hair loss, and it's really been magical for myself. Some people do experience side effects with finasteride, but for the most part, they're very rare. I personally haven't had any side effects from this drug. The next drug I use for hair loss is minoxidil or Rogaine. This is more of a growth stimulant. It does work for male pattern hair loss, but it's definitely not as good as finasteride. But if you're really looking to optimize your hair loss routine, you could definitely consider adding minoxidil on top. I use minoxidil once per day because I just can't make time to use it in the morning, but to get the best results, you should be using minoxidil twice per day. The next product I use for my hair is called ketoconazole, and this is an anti-fungal shampoo. I primarily use ketoconazole for treating dandruff. However, a lot of people do use ketoconazole for treating hair loss as well, as there is some evidence that it is effective. The last thing that I've used for my hair, I don't really use anymore, and it's called derma rolling. You pretty much puncture these, tiny little holes in your scalp. There is evidence that derma rolling with minoxidil is effective for treating hair loss. Personally, I just haven't really been able to follow this regimen consistently just because I find it's pretty invasive, pretty uncomfortable. So we've talked about hair, let's talk about skin. One of the biggest issues that people have with their skin is sun damage. Radiation from the flaming hot ball of fusion that exists at the center of our solar system is causing about 90% of visible aging. So the best thing that I've done for my skin has been to incorporate a sunscreen moisturizer into my daily skincare routine. This is a moisturizer with SPF 30, and I find it's very cosmetically pleasing compared to other types of sunscreens. It's the CeraVe SPF 30 moisturizer that I use specifically. Obviously, if I'm going to be out in the sun for longer periods of time, I'll use an SPF 60 sunscreen, and I'll wear a wide brim hat and sunglasses, and I'll try to stay in the shade if I can. And then the sun helps to make vitamin D, so I'll compensate this by taking vitamin D supplements. So we've talked about sun damage. Let's talk about the next biggest issue that people have with their skin, and that's acne. Because acne can be really horrible, especially if it's not treated. It can result in these permanent acne scars that I think most people wouldn't want to have. So to treat acne, I've actually used a drug called Accutane, and it's the best drug that I've ever used for my skin, to be completely honest. I naturally have very oily skin, which is more prone to having acne. So by taking Accutane, the drug effectively shrinked my oil gland. So my skin is less oily, which resulted in having less frequent acne breakouts and less severe acne breakouts as well. Obviously, Accutane causes a lot of side effects as well, so talk to your doctor about that, but let's move on. So I also use some topical products as well. I use a product called Differin XP, which is adapalene, and this is a type of retinoid. What retinoids do is that they increase skin cell turnover, which has been demonstrated to help decrease wrinkles. So that's one reason I use a topical retinoid. I also use the topical retinoid for acne as well. And then if my acne is really bad, I'll combine it with benzoyl peroxide in a product called Tactupump Forte, which is also very effective for acne. So we talked about skin, we talked about hair, let's talk about teeth, because I think that teeth is one of the most underrated parts of physical appearance. The best thing that I've done recently for my teeth is I've switched from manual brushing to an automatic toothbrush called the Philips Sonicare. And it's good for a number of reasons. The first reason is that I was experiencing some gum recession because I was brushing too hard with the manual toothbrush. By switching to the Philips Sonicare, which does not brush up and down in that type of motion, but it actually just simply vibrates and you just guide it gently along your gum line, supposedly it should cause less gum recession, so I'm really looking forward to that. The next benefit that the Sonicare has is that it helps to remove more plaque from your teeth. So I was also having a lot of plaque buildup, which resulted in some gingivitis or gum inflammation. Part of that was being caused by improper brushing technique, especially in the back of my teeth. So the Philips Sonicare just makes it so much easier to brush in all the places that need to be brushed to really remove that plaque. The next thing I've done is I've improved my flossing technique, right? So when you're flossing, supposedly you're not just trying to remove food from between your teeth, you're also trying to get under the gum, right? So you actually floss all the way down so that the floss goes between your tooth and your gum, because that's where a lot of plaque also builds up. And then lastly, I use an aseptic mouthwash, and that should help to kill the bacteria that are causing my gum inflammation. So we've talked about teeth, let's move on to some miscellaneous products. The first miscellaneous product I take is a antidepressant called bupropion. Now I have a history of major depressive disorder, so this probably isn't necessary for you, but I find that bupropion helps me to stay motivated throughout the day. It helps me to adhere to a good diet or a relatively good diet. It helps me to adhere to a relatively good exercise routine as well. And bupropion, unlike other types of antidepressants, also does not cause weight loss, because that's a big issue that some antidepressants have. And then the last product I use is a type of makeup. So this is just regular foundation, and I use this exclusively when I'm shooting videos. The reason for that is because it's very difficult to correct skin tones in post-production. So I found it's just way easier just to apply some foundation and then edit the video afterwards than to have blotchy, uneven skin and then try to fix that with all the color correction tools. It's just very difficult. So that's all I have to talk to you about today. Thanks for listening to my ramblings. I hope this video has been informative. I hope it has been somewhat understandable. Again, I just wanted to make this video because I see so much BS that's out there, especially products that celebrities and influencers promote in order to make themselves rich, and I feel like that's pretty unethical. So thanks for watching, and I'll see you in the next video.